Hey, hello. Welcome again to Facebook Live. This is Bill Bird. I'm the Chief Medical Officer here at CGH Medical Center. Welcome. Glad you could join us. And I'm happy to have today Kristie Geil. And Kristie is the Chief Nursing Officer here at CGH Medical Center. And she's going to have a lot of good information for you all. This started out where I just asked Kristie, hey, can you give us an update on the visitor policy? Because that's been a topic on this Facebook Live for several weeks now, and Kristie does have some information to share about that. Mm-hmm. But as things go, I'm like, why don't I ask her some other questions too? Mm-hmm. So that's what we're going to do. We'll get to the visitor policy in just a few minutes, but yeah, I want to start with some other questions.
Okay.
And Kristie, true to form, has all her notes written out of what she's going to say. So she's going to try to look up as much as she can and not look at those notes. But yeah, she's very organized, so that's great. And one other thing, so we've had some internet connectivity issues here at the hospital. So we're going to count on this all working, but there's a chance it doesn't. And if it doesn't, like last time, we'll kind of cut and paste and put things together and send it out later. So, with all that aside, hello.
Hello. I was telling him, I was kind of hoping to get through this whole situation and not have to do this, but he roped me in.
Gotcha.
So, we'll have some fun.
Yes, ma'am. All right. So, first, kind of just some more generic, or not generic, but more just kind of bigger picture questions for you, Kristie. So, what's your experience been like?
Yeah.
During this COVID pandemic from whatever that was, March 15th or 14th until now?
So it's funny, a few of us were actually talking about this yesterday and where we were back in March 15th and leading up to March 15th to where we are today. And so I did write a couple things down because there's some key dates that I think are important to just kind of remind somebody because in the group. Back in around February 3rd, we were really doing the watch. We were kind of seeing what was going across the nation and trying to anticipate what was coming. We actually started our travel screenings back in February, if you can believe that. We've been doing travel screenings. Yeah, February 3rd, we started travel screenings. And then our internal task force here started off first part of March. So we've been meeting that long. It's just flown by. And then fast forward to the 15th. And I think that's a day that will live with all of us forever because that's really when our incident command kicked off officially.
Incident command.
Yep. No, that's a good point. So when you have a major situation going on in your community or that's going to impact the hospital or the community, we have a formal program here that we utilize, and we call it Incident Command. And it's a group of the leadership team, so all of the administrators here, as well as key individuals in different areas. So, Dana, that she doesn't want to be referenced to, was part of that. Yeah. So we started, on a Sunday afternoon, really meeting consistently. Right out of the gate, we were meeting several times a day. Sometimes we met all day, to where we are now, which is once a week. And of course, there's a lot of work that goes on in between, but it's been nice to see that taper off because we're on the other side of it. We're mid-June now, and I think last count, we are just shy of 2 weeks of not having a positive patient in the house, or in the hospital. Sorry, we call it the house. It's really nice to be on that side of it. Our designated bubble areas that we called them, you guys have probably heard of that term throughout all of this. Those are down. However, we are still using appropriate precautions for those that are positive if we would have one come back in. They go to our negative pressure rooms. On the other side of it, I have surgical nurses that are so happy to be doing total joints and lap choles again. And it's nice to be able to serve the community in our normal fashions. It's great.
Good, thanks. So kind of that flows from that is, what would be some of the key things you feel like you've learned these past 3.5, 4 months?
Sure. The first thing is be creative. I think we learned that very quickly. Dr. Stanky actually said that to us in the incident command meetings. We had to start thinking out of the box. We drill for these types of situations a couple times a year, but this was a real life circumstance, and some of the things we planned for worked really well, and then we had to think out of the box for other things. And ironically enough, our Chief Information Officer, Randy Davis, Dr. Stanky said, go be creative, go out and look online, what's best practice? And he brought to us the University of Nebraska's mass disinfection process. And we had that up and running before I think people were blinking at whether that was an opportunity. Luckily, we didn't have to use them, even though we have well over 600 masks disinfected and ready to roll. Because we thought out of the box again and had some staff, an individual who is also a veteran, who came to us and said, industrial N95s and N100s could really bridge us, and that's what we did. Mm-hmm. And we have over 332, I counted.
You have a lot.
Yeah,
Yes.
industrial strength masks out there. So
thank you, Alex.
yeah, good job, Alex. But we also just did some unique things with our materials management group. If you guys had seen the way that they organized and had the distribution set up for materials management for supplies, you've been really impressed. The best logistics people in the world would have been impressed with how Claudia and her team put that together. We did some really creative things with technology, televisits, telemedicine. Our medical staff thought, maybe we could do some kind of hybrid televisits on the units for our COVID patients. We have one pulmonologist here at a time. You really want to conserve that specialty. So thought out of the box there.
And that's interesting because speaking of learning from stuff, so we had it set up so like the patients that were either under suspicion of having COVID or actually were positive for COVID, we had cameras in their rooms, so at some of the visits, the medical staff and nursing staff could have conversations with that patient without having to be in the room, so we didn't have to use extra PPE and those type of things. And the reason that we set it up for ended up not working so much because our docs ended up going into the rooms anyhow because they wanted to be in contact with the patients.
Right.
But what's kind of flow from that is now you're doing more work on the nursing side with monitoring patients that could
Telesitter.
That could be. Can you want to speak about that?
Sure. So telesitter is for those patients that we have a little suspicion that they might be a little bit confused, and we want to make sure that they don't fall. So I have a centralized station with a CNA that are watching those high-risk patients to make sure that they stay safe. And we have two-way communication, so we can talk to the patient and they can talk back to us. And on any given day, we might have 5 or 6 patients on telesitter now. And we're really hoping to see a difference in falls, preventable falls, because of that program. So things that we learned that we're now taking into new practice.
You start thinking you're going to use it for one thing.
And you use it for another.
Oh, well, that's not working, but it's working for this. And so
it's been really great.
Yeah. Anything else? Any other take-homes?
Just some general things like resiliency. Shout out to all of our staff and our physicians. Unbelievable resiliency and creativity. Our cafeteria. So our cafeteria, we had to cease to function essentially, except for the staff. So they took that moment and said, well, what can we do different? And they started creating take-home meals, which was huge for the nursing staff and many of the staff in different areas, because you could go down and get for $20, get a full meal to take home to feed your family. And I'll tell you, most of us were pretty tired at the end of the day, so that was awesome.
Yeah.
Wish they would continue that one. And last but not least, just the community support. I'm going to get sappy, but at the end of the day, being a staff person in those COVID units and knowing that there were cars outside the door twice a day in the parking lots praying for you. I mean, what a better way to celebrate our community. Yeah. They were really there for us, as well as just vendors. Randy was working with Wall Clipper on masks and face shields, and just people thought really creatively. Yeah. That was fun.
Yeah, that was
fun and hard at the same time.
Yeah, very good. Thanks. Matter of fact, I have a prop. 1 second.
There we go.
That right here.
Yep.
Okay, so I'm back. Hello. So this little thing, that's my face mask that I have to wear around. And then this thing is actually what most of our folks would think of, that you would put your sandwich or your lunch in. And somewhere pretty early on in this process, when we were talking about proper masking, one of our dietary workers, I'd give a shout out if I knew exactly.
Miss Carenza.
Oh, was it Carenza?
Miss Carenza Pink.
Okay, so the person who manages that department was like, I think what you're talking about, we could use what we have in the cafeteria for sandwiches to store our masks. And so, for a long time we've been doing that, and it's a great system, and it's just, we've done a really good job of thinking about different ways to use things that we think of for other purposes.
Yeah.
So,
yeah.
Anyhow,
there you go.
Your visual
for the day.
For the day.
And I want to one other shout out on that regard, of how we took care of each other. Our Caring Fund and the CGH Health Foundation came together and really had an outpouring of donations to help coworkers that were really struggling during this time. And I called to get a number on that, and Beth Warner let me know today that we've given out over $26,000 in gift cards to employees that were in need for groceries or gas or what have you. And so it just, it really felt like a family.
Good, thank you. So, as I mentioned earlier, I did want to make sure that we talked about our visitation policy, because it definitely has been, it's definitely been a point of conversation or questioning almost every week for the last, I think, 3 weeks or so. And I know Kristie and her team have been working on that, and if you can share where we're at, what the plan is, and I'll give the floor to you on that. Okay,
so we do have a plan in place to start easing some of our visitation restrictions. You're going to see some changes in communication come out probably in the next week. We are waiting for some recommendations from IDPH just to ensure that we're not getting ahead of the game. To be completely honest, Whiteside County had a fair number of cases, and so we have cause to be cautious and cause to not be reckless with this. However, we also know that, some of you are making decisions about when you have your surgery and when do you come to the hospital, knowing that you can't bring someone with you, and we acknowledge that. We know it's important. So what you're going to see probably from marketing and on the Facebook page and on our website is what those restrictions are going to ease up and look like probably over the next week. I'm thinking probably around the 29th of June. I say that tentatively, so don't go and mark your calendars just yet. We have a few things logistically we want to make sure we get together before doing that. But a couple things that I did write these down because I don't want to forget any of them, so I apologize for looking down to read them. But there's some cardinal rules that everyone needs to be aware of now, and that we will continue to push through as we make these changes, because they aren't going to change as we roll this out. First of all visitors will be required to wear a mask at all times, and we will ask you to stay in the room with your loved one while they're here at the hospital. If you can't physically or primarily physically can't accommodate that, where you can come in and sit with a mask on for a few hours, then we'd ask perhaps that you just find someone else to be designated, because we really would prefer not to have that conversation with you and ask you to leave. So if you're having a choice as to whether you can mask or not, and you don't think you can comply with that, we would just ask that you not present to visit at all. It would save a lot of conflict down the road potentially. Second, all visitors will be screened when they come to the hospital. The plan right now is to have you screen at the front door for temp and history and that type of thing. And if you pass through that screening, then you'll go to our information desk. At the information desk, we will have a list of the patient and who their designated visitor is, so that we can check you in and make sure that you are the person that's designated, because we are going to be limiting to one visitor per family member or per significant other or support person. You'll be provided a sticker of some sort. That sticker is going to change color every day, so that when you are out and about in the hospital, which you shouldn't, because you should go straight to that patient's room, we'll know that you're the designated person, and that just helps us all stay on the same page. You will not be able to consume beverages or eat while you're here. Our cafeteria is still going to be closed to the public, and that is in line with IDPH guidelines. So if you want food or drink, we'll ask that you leave and consume that in your car, or go to a local restaurant, because we need to support local right now, and consume it there and come back. Because you can't wear a mask constantly if you're taking it off to consume food or beverage.
Yeah.
Our waiting rooms are limited. So diagnostic imaging, radiology,
like
X-ray, thank you.
Yeah.
And our clinics will probably still be somewhat restricted, because we actually have patients that are waiting in other waiting areas as they go in for their tests. So that's one limitation. Exceptions will be made for end of life, OB, and special needs. So I would like to put a plug out. If for some reason you are coming in to have something done and you have issues with mobility or other things that would require you to have someone be with you, please call ahead and let us know that, so that we can be prepared for you coming and expect you to be there.
Okay, good, thanks. So, and I know our marketing folks will be pushing stuff out.
Absolutely.
And everything, but it sounds like pretty soon we're going to have good. And when we know that it's one of those things that, it makes sense as much as we can to get folks, because there's a lot of conversations that happen where having two people listening is more helpful, and even asking questions is more helpful than having just one, particularly someone who is sick or, so we understand that. We want to do our best to balance
all of it.
Getting people to hear conversations, but also preventing infections and keeping people safe.
Agreed. One of the things we have been doing is the research leading up to this decision. The information's coming from University of Wisconsin-Madison, University of Iowa, downstate in Springfield area. So we're learning from others that are testing this out now to see if it's safe and it's not impacting those hospitals, and so that we can then apply that same logic here.
Yeah, good. Great. Anything else while we're kind of talking about stuff?
Sure.
And related to COVID, Kristie is a wealth of information on that. So anything else new from like a nursing or infection prevention standpoint in terms of COVID that you wanted to share with the folks listening?
At first, I want to just thank everybody in the community who have been so dedicated and vigilant and compliant. This was a community effort to bend this curve, and we did well. And that's because everybody got on board and supported each other. Our concern right now, as things start opening with phase 4, which I don't know how much you talk about the phases here.
A little bit.
Okay,
Yeah.
So as the state goes into phase 4, where things are opening up a little bit more, those types of things, from a nursing and IC infection control perspective, we're really worried about apathy. We're worried about people assuming that they're safe. I liken it to when you drive on Interstate 88, there's not too many people that actually drive 70.
Yeah.
And they think that it's safe to go ahead and drive 75 or 80 or what have you. They think they're they're driving in a safe zone. I'm concerned, and Gina Superzinski is concerned, that we will have some apathy and people are going to get out, and I'm starting to see they're not masking.
That's one of the questions here. Do you think people are getting too relaxed about COVID because we've not had many cases lately? Yeah,
and it's warm out, it's nice, it's hot, masks are frustrating and you're sweating under them, and so you want to take them off to breathe. What I can tell you is there's 332 staff here that have been wearing N95 and N100s consistently, and we would really like to not have to put them back on. So you wearing a mask will prevent us from having to wear a mask. But yeah, I am worried about apathy. And just make sure that you're being vigilant and maintain that vigilance for a while, because you just look at the news today. I think Florida has had 3,000 positives yesterday. So we can learn from what other states are doing so that we do this the right way, and that's what we need.
And I echo that. I mean, I definitely have seen more and more folks that they're struggling to keep an eye with doing social distancing and masking. Those are the ones that are very noticeable, because when you're around folks, you can, if they're not socially distancing, it's pretty obvious. And the same with the masking, or the mask is here, and those type of things. And it's also becoming more. The reality of wearing a mask is just one piece to make you safe.
Yeah.
It's not like it's all in all. And the whole point of that is to reduce the number of folks who end up in a hospital, then it reduces the risk for healthcare workers who are taking care of those people. It also, when you're wearing a mask, you're not really protecting yourself, those cloth masks.
Protecting everyone else.
Protecting other people. And those other people are people who maybe older or maybe around older people who can get sicker from this. So it's more about that. And, you know, not everyone who's not wearing a mask, but there's a component of it seems like it's becoming more like almost a political thing.
Yeah, and it shouldn't be, unfortunately.
Yeah, you know, people get to decide how they're going to look at things, but instead of being about infection prevention and trying to protect our most vulnerable, it's become more of a, not always, but in some situations, more of a political thing. And, you know, I hope that we can kind of tamp that down a bit, because from a person who takes care of people or is around people who takes care of people, it's really about protecting and keeping our most sickest and vulnerable folks. Right.
And I saw we had an email just before that came out from Whiteside County that part of Phase 4 is that they're going to allow some visitation at nursing homes to be outside. So again, you know, we're testing these waters a little bit, and we need some time to make sure that it's safe to do them. So if we run with scissors.
Yeah, and I take care of patients who are nursing home patients, and in talking to nursing home personnel, they are really struggling. You know, to not be able to think about it for 3 months now,
right,
to be like in your room or barely out of your room and not able to interact a whole lot with your family members, and that's, you know,
right.
So anything that we can do to get those folks more connected with their loved ones, I am 100% in favor of them. I'm more than willing to walk through a store with a mask on
Me too.
to allow that to potentially happen sooner.
Yep.
Another question before we get to
Sure.
our questions: how accurate are the nasal swab tests? Is a negative result truly a negative result?
Actually, the accuracy, I think as we continue to move forward with this, the accuracy of those results are incrementally increasing. The approaches, we're learning every day with the different approaches, but we've been very successful with the corporations that we're working with for reference labs, as well as our own internal lab testing, that I believe that's really good. You can speak to that percentage probably better.
And we balance that with the understanding that there was an article in, sorry, I'm not supposed to tap. There was an article in one of these sites I think it was Doximity is the one that I looked at, but there is some bearing here in terms of the percentage of positive people you have in the community, and then how helpful those tests are.
Sure.
So what we've done is, if someone is really high suspicion, and particularly someone who's hospitalized, if they're negative, once in a great while we'll retest them. But by and large, if someone's negative on those tests, we're going with that.
Well, in the ones that we have retested, we didn't see a change in.
So far, at least. Yeah.
So,
I feel pretty good about the results of the negative positive tests, not the antibody tests.
Agreed.
Not happy with those in terms of an individual making decisions.
As well as the rapid testing.
Yeah.
At
not
this
quite
point.
As good. Yeah. All right. So that's so far what I have from our folks who are listening.
I have one more thing on just kind of general thoughts, though, is, you know, we are at a point now, and Gina would say the same thing from an infection control perspective. If you need care, you need to seek care. If you've been holding off on your mammography, if you've been holding off on your colonoscopy, and those things that are just preventative healthcare tests and procedures, you need to reconnect again. It's safe to reconnect again. With our pre-op testing that we do for procedures to determine whether or not you have COVID before you come in for your surgery, those things are already in place. It's safe to come back and seek out that health care, because honestly, I think, you know, we're seeing a lot more mammographies now because people have held off. Yeah. What we don't want is to have you guys out there not feeling well and being worried. It's safe. It's always been safe, but it's time to come back.
Good. And people are, I'll tell you,
Yeah.
they're close to capacity right now, so that's good. So you've kind of already spoken to this, Kristie, but just to make sure that I give you an opportunity, what ways have you seen our nursing staff rise to the challenge during the past 3 months?
His goal, he's Barbara Walters here. He just wants to see if I can cry. That's the key here.
Oh, yeah,
No, you know, I was thinking about this a little bit as we were kind of prepping for this, and I think the nursing staff here made some choices, and really so did all of the healthcare providers that were providing direct care. They had choices. Do I come to work? Do I opt out? They chose the community. They chose to show up, and they kept showing up, and they continue to show up. And there were days that were hard. We had days where and it wasn't hard because the care was hard as much as the constant change was difficult. We had a Friday night. We would always change things on Friday nights. It wasn't because we wanted to, but that's just how it would work. You know, I'll never forget every time I would get to one of those units and have to huddle the team together and talk about the latest change or what have you. They just chose to commit, and I'm super proud of them for that, because they didn't just commit to CGH, they committed to the community, and they really shined. We have a lot of new graduates who learned an awful lot that some of us that have been around the block a few times have never experienced. This was a once-in-a-lifetime event. You know, we had Sandy Westbow, who pretty much came out of retirement so that we had 2 infection control nurses here full-time. We really needed it, and that was amazing. And she sat on here for how many weeks with you?
Yeah, several. Until she got tired of me.
We had CCU nurses that got together and said, you know, I'm going to go in COVID. Can you go to COVID? And, you know, you're a little older, no offense, and I'm not going to. We're going to have certain people that are going to go back in the units and certain ones that aren't. And they really stepped up for each other as well. And I can't speak any more highly than possible that the thank yous aren't enough for the ED staff and the Ready Care staff.
Sure.
Those guys are warriors. They really are. And they didn't know, on any given day, they didn't know what was going to walk in the door. And they handled it professionally. They had ED had some significant end-of-life related issues that they worked through really professionally. And I'm not going to say that we're perfect, but they really did shine through this. And lots and lots of names and hours of stories I could tell you, but I'm really proud.
Yeah.
Really proud.
For sure. I echo that 100%. And obviously, nurses alone don't just take care of patients.
Right.
So there are a lot of folks involved in taking care of folks here at the hospital. Can you, from the seat that you sit in, Kristie, can you share how you've seen other departments step up and help out with folks during this time?
Well, I'll start off with just any support department, frankly, and really respiratory care goes right up there with nursing because they were working directly with these patients all the time. But support services, so environmental services, honestly, we have the best housekeeping team of any hospital I have ever been in, and we have the cleanest hospital that I could ever see. I've been to some other places.
It's clean.
These guys are excellent. And it was great when you go out to the units and we're huddling with the nursing staff, they were right there with us. And, you know, I'm sure we were very messy at times with our little boxes for our masks and things like that, but they were right there along with us. Plant operations and maintenance. These guys, you'd pick up the phone and say, I need to put up a temporary barrier. And they were there, Johnny on the spot, putting those up, taking them down, moving them, adjusting them. The tent outside, they put that up and put it together. Amazing. And there's a group, too, that never gets any recognition, but it's the 2 others that are sitting in this room with us, and that's marketing.
Yay, marketing.
Yay, marketing. You know, our community knew what was going on because of this team. The constant updates of Facebook information, the knowledge, the really nice snippets that were short and sweet, but the community needed to see and hear. They worked with the health department to ensure that we were all having the same message. I think probably Liz has made at least 100 different signs that she has reposted all over the hospital and the clinics to make sure everybody knew where they could go and how they could get there.
Yeah. She's a sign queen.
Very much so, and really good at it too. I did not see one spelling error this entire time, so that's really good. I'm sure there were, but maybe not. You're pretty detail-oriented, so no. But anyway, the clinicians get a lot of the credit, but we couldn't do our jobs if we didn't have the tremendous support of it's a team. Where we call it a house because this is our home.
Yeah, for sure. Yeah, great. I had another question pop in here. Let me just take a look at that, Kristie. I want to make sure I get all the questions. What do you think about school starting and busing the kids?
I'm going to go back to the adage of where we're at with phase 4, and I really truly believe that the school systems in this area are doing exactly what they need to do under the guidance that they've been given, but we're all challenged with it. As far as school busing, I would look at it from the vantage point, again, of social distancing and universal masking. Are the kids all going to have masks on, and can they be separated on the bus enough to ensure their safety? And those two seem to be the foundation philosophy that we need to follow universally, and that's kind of where my thought is on that.
Yeah, yeah. It's going to be
interesting.
Yes.
Yeah.
We have enough in our world to try to think about without, but that's going to be interesting.
Yeah, but they'll do very well. We've got great leadership in our school systems here.
Yes, we do. So I want to make sure in our time that I'm not shortchanging anything. I'm just, before we go any further though, I did want to ask you, Kristie.
Yeah.
So people, this woman from the cornfields of Iowa.
Yep.
You ended up a nurse.
I did.
Yeah. So.
Yeah.
What I ask everyone who comes on, I ask this. So just like how they ended up doing what they're doing. So how did you end up deciding to pursue a career in nursing?
Well, my mom's been a nurse I think she finally let her license lapse when she was like in her mid-70s.
Okay.
And she was a great example. Mm-hmm. And I had lots of aunts and uncles, and they always would come over and ask Mom questions, and she was a great example for me to follow. And it's funny because now we're in the 3rd generation, and
her mom was a nurse too?
No, my niece is,
yeah,
and she is following right in line with it. So I think maybe it's genetic a little. I don't know, but yeah, she was what inspired me.
Yeah, it's definitely environmental.
Yeah.
Okay, so decided to follow Marianne's path.
Yes, who's still here? Who's very, very eager to volunteer here again, by the way.
Yeah.
But
that'll
be a bit yet.
Yeah. So good. And then I want to make sure we get this into one of the other things, kind of a segue from COVID. I want to make sure there's no questions. Okay, is Kristie's really involved in kind of getting off the ground our behavioral health unit. Mm-hmm. So I'd like to give you an opportunity here, a platform to kind of talk to the community about what's going on there.
Sure. So, as many of you know, we are going to be opening an adult behavioral health unit here, and hopefully it'll be opening after the first of the year in 2021, probably around the January, February mark. Currently, we are in the process of doing all the renovations to the department, meeting with the architects and the planners and Cindy Zander and Bob and the group, because we are actually building this department out on our own. It's very exciting. We actually signed a contract with a nurse practitioner who will be our clinical nurse practitioner in psychiatry on that unit. And fingers crossed, we will also have a part-time psychiatrist that will be working with her directly within the next couple of weeks. So our clinical team is coming together nicely.
Yeah.
I would hope, and this is kind of my plug out here too, we will be looking to post nursing positions and support systems positions probably starting mid to late August. We really want to get these positions hired and spend some time getting the team together so that we can do some training and really kick this off well at the beginning of the year. So please watch for postings if you're interested in behavioral health and want to join our team. I believe those will be coming out mid to late August.
And to speak of like the work that's being done from a construction standpoint, I haven't been down there since they started like tearing down stuff. But do you, where are we at with that? And
So it's completely down to the studs. We've been doing some infrastructure changes to make sure that we meet all of the requirements of IDPH and Joint Commission. I haven't honestly been in there either.
Yeah.
I do know it's down to the studs.
Yeah.
And our plans have been approved by IDPH, so
Yeah.
we'll be moving forward and
If you drive by the hospital and that part of the hospital that kind of jets out towards, I forget what, but it's where the T road is, where the car went through the building. That area, that part of that wing of the hospital. If you see plywood on the second floor, that's the area where our
we're building it out.
where
And
Bob and his team are kind of getting that all taken care of.
Yep, and if you see additional, right now we're taking down that second helipad off the roof there too. So all of the construction and things that you're seeing there are really, the helipad isn't related to behavioral health necessarily. No, but a lot of the activities you're seeing there are related to the actual construction of that unit.
Yeah, because did you mention the needs assessment, like community needs assessment?
I didn't, but
Okay,
yeah.
Yeah, so like, and part of this too is, it's been a while now, but we consistently on a community needs assessment type of thing, mental health services, it comes up, and Mississippi and the health department do a nice job with a lot of the outpatient kind of stuff, but it's been, ever since I've been here, it's been a struggle where you have patients that will show up who get to the point where they need to be, at least for some period of time, in a hospitalized situation, and having to send those folks out has not been as good a fit as we'd like for our community. So this is going to be, I'm really looking forward to it.
I am too, and it's not like it's a mega unit; it's a 10-bed unit. But we're really excited to be able to offer the service in town because the vast majority of our patients were being shipped into Chicago, and it's problematic because then we lose you to follow up in those outpatient areas, and that's going to be really important to us because then we can provide the continuity of care in the community that we know that you all need.
Yeah, good.
Not everybody.
Good. So, a couple other things I just want to make mention of.
Yep.
First of all, we talked last week about blood and the shortage of blood. Just so, for those of you who are listening who either went and gave blood or encourage other folks to, thank you.
Yeah.
Because we're not in the green. They go green, yellow, red in terms of blood. We're in the yellow as of yesterday, 2 days ago, in terms of our O negative and O positive blood supply, which is 2 days. Where before we were at 1 day, so thank you. And I also, though, encourage you and or those that you know who are those blood types to call our Mississippi Valley Regional Blood Bank, and you can go and donate. And I'm hearing maybe there might be a blood drive. Anyhow, just call Mississippi Valley for now. If there's going to be a blood drive, we definitely will post it. We'll put it on Facebook and also our website at the hospital. But thank you for those of you who have been involved with that. And one little blip on masking too. Some of you may have seen this, but there was some that came out this week that the people that are smarter than me that figure out modeling have said that states that have made masking mandatory, they feel like that's between 250 and 400 and 230,000 and 450,000 cases in states with mandatory testing of reduced number of cases, which is part of why Illinois
is doing this.
Doing so well.
There was another study that came out recently that said if you are with somebody who is asymptomatic or symptomatic and you are not masked, your chances of transmission are around the 14%. But when they mask, it drops it to about 2 to 3%. And that's a significant, that's not something to ignore.
Right.
And really, now the data is finally coming back that really proves out the impact of universal masking.
Yeah.
And I'll tell you, I wasn't a believer initially,
Yeah.
But I definitely am now.
Yeah, good. I have 2 more questions and I'll let you be.
Okay. I did good so far.
Oh, yeah, you're doing great. So I want to get back just to the nursing side of things. And the other thing about nursing that I've grown to appreciate over the years is it's not like you just get done with nursing school.
Right.
And you're like, okay, go get them.
Right.
So, like, to be a nurse anywhere, but like, across the hospital, let's just say.
Sure.
There's a lot of work beyond that.
Mm-hmm.
And I wanted our community to hear about in terms of nursing profession and what it takes to kind of be taking care of you as you see them at CGH. So if you would speak to that, Kristie.
Sure. Thank you. When I came on to work here years and years ago, you came out and you got on the floor and you forgot everything that you learned in college, and you might have had a couple weeks of training and then you were on your own. We actually have a full residency program here. So any new graduate that comes to CGH actually goes through their normal nursing orientation, but then we also, on top of that, we follow the University of Iowa's nurse residency program. We're just making that switch over to that methodology. We used to use Transitions to Practice, which is a different evidence-based training program. And that's just, it provides nurses with the opportunity to not only learn some additional clinical skills related to critical thinking, but it also teaches nurses how to deal with conflict management and delegation and how to have those crucial conversations with physicians and families. So we do that residency program. It's a full 6-month program to ensure that these nurses are feeling comfortable joining the practice. I was, interestingly enough, looking at, there's a annual study that comes out related to nursing retention and recruitment, and their numbers just came out like 2 days ago. And still, nurses that come out into the field, there's a 25% turnover rate in the first 2 years. Because they get into practice, they realize it's a lot different than what they thought it was going to be, and so they leave the profession altogether. So what we work towards with this residency program is to make sure that we can retain the new nurse, because once we get out 2 years, those rates drop significantly down to about 10 to 12%. We're lower than that already, but with the shortage of nurses, it's important for us to really be on top of that.
Yeah. Well, the other reason I asked that, I was in the unit in the ICU yesterday, or I think it was yesterday, time flies, and I was talking to Tricia and Elliot, and they're some sort of like CCP. Oh,
they're getting certified. Yeah.
Yeah.
So there are additional certifications nurses can get once they're done with school through their professional society. So if you talk to any of our emergency room nurses, they probably have 2 or 3 different certifications that are actually just required to work here, whether it's trauma, pediatric, resuscitation, you name it. Our OR staff, they are working towards their certifications, and the CCU staff as well. And it provides them the opportunity to grow in their specialty, but it also requires them to have continuing education every year to keep that certification, and that continuing education is what's most important. That's the key.
Mm-hmm. Yeah. So for those who are listening, I wanted to ask those questions because I think sometimes if you're a lay person and aren't around the medical profession, you don't realize how much not just the physicians, but like all the folks that are doing clinical care are kind of up in their game all the time. And I just wanted to make sure that we had an opportunity to talk about that.
Well, in each of our nursing departments has a designated nurse educator that helps with those keeping on top of everything, and they were key during COVID. Our nurse educators were amazing because they were here at all times of the day training on new masking techniques or fit testing or walking through isolation precautions and making sure everybody was following things according to plan. And it's a nice way for them to grow professionally as well.
Yeah, good. I see Dr. Herman says hi. Hi, Dr. Herman.
Hi, Dr. Herman.
Glad to hear from you. One last question.
Yes.
Okay. What's the favorite part of being a nurse to you, Kristie?
Well, you could probably answer that one for me because I'm also known as the structure junkie amongst our administrative team. So my favorite part of nursing is problem solving, and seeing the problem in front of me, whether that's assessing a patient or in my role assessing a situation and examining it, assessing it, and coming up with solutions to fix it so we make it better. Not many professions can you do that consistently every day. and see that positive end result.
Yeah.
So that's my favorite part.
And you do that well.
Thank you.
Yes. Hey, thanks everybody for listening. Thank you for taking your time to listen and send us out to other folks. And Kristie, thanks for being
thanks for
part of
having me.
things this week. And look forward to chatting with you all next week. Thanks. Bye.
Bye.